Hey everybody, I'm Dr. Daniel Choi here at North Texas Dental Surgery, Wisdom Teeth and Denture Implant Center.
And I'm Dr. Adam Bellingham of the Grapevine Dentist.
All right, so Dr. B, I'm great at seeing when a patient needs a night guard. And honestly, I think they say that 80% of the population has a parafunctional habit, meaning clenching or grinding, right? And I'm a big time clencher.
Same.
To the point where I actually used Botox about a month ago to help relax my masseter muscles. But I also have had a night guard before, and I need to get a new one.
Yeah.
And I already told I need to make me a new one, right? But anyways,
I got one.
Let's talk about this. This is such an important topic, right? So it's what is it? July 31st, 2021. 2020 COVID, and even extending this year, has exerted a ton of stress on people.
Yes.
Meaning clenching and grinding galore, meaning fractured teeth like crazy. You've been seeing it, I've been seeing it. And let's talk about night guards. Let's talk about like what are our options for night guards, because we have different types. And I don't really know. Again, I'm good at spotting when I see patients that need it, because clenching can cause so many issues, fractured teeth. And then also recession, right?
Recession.
I know somebody that might need something like that. Right? So you need to get fixed, I need to get fixed. So tell us about like how night guards can really help us out in the different types, and tell us about one you can buy at the drugstore.
Night guards are great. I mean, honestly, almost all of us should probably have one, nowadays with the stressful lives we all lead. So the point of a night guard is to basically even out force and you wear and tear on the night guard versus your teeth. So most of us at night are doing, like you're saying, 80% of people are doing some kind of what we call parafunction, which is you're doing something with your teeth that's outside the norm. So you're either clenching them together really hard, or you're grinding in one way. Some people grind forward to back, side to side. People can do some crazy stuff with their jaw when they're asleep.
Are they even awake?
Oh yeah. And it's habits that you can even do. I mean, you might be in rush hour traffic and you're squeeze it. People will do, it's real common, people are concentrating on something to rub their front teeth together. Just habits that we do.
I do that during the surgery.
I find myself pushing my jaw hard when I'm under my mask when I'm concentrating. It's
like Kobe Bryant, like when he scores and like
exactly.
You're doing
exactly.
that
But it's the weird stuff that we do. And so, but the problem is when we're doing those things, it's not really what our teeth and muscles were designed to do. Like our teeth are not meant to be squeezed together constantly or ground on each other like against sandpaper. It tears them up, and it's hard on your joint, it's hard on your muscles, and causes damage to all that. So the goal of that is to make sure that we're evening out those forces, because we can't, from some of the newer stuff is saying there's reasons why we're grinding. We are still researching that. There's supposedly, you have a protective function in your brainstem that when you squeeze together, like say you try and put your front teeth together and squeeze, your brain won't let you do it because it's uncomfortable. You can't smash your front teeth together like you could your back teeth. Supposedly that protective function lessens or turns off to an extent when we fall asleep. And that's why we can grind teeth in such a weird way and grind them so hard. The other theory, which could be a whole other topic, is they're now thinking airway has a lot to do with it, obstructive sleep apnea. People who are not necessarily diagnosed with sleep apnea but are having micro instances of obstruction, they're trying to engage their airway, so they're using their jaw muscles and it makes them grind. Jury's still out on that. That's kind of like the newest area of research on that. But anyways, long story short is you want to put something in between your teeth to take the wear and tear. There's different types of night guards that'll serve different functions. If you are just if we look in your mouth and we see that you've got wear on your teeth, you've flattened out your cusps, or you've made some weird grooves or notches into your teeth that when you close together we can see how you fit together, then almost any kind of night guard would probably work for you. Technically, if you're a big clencher or grinder, a hard acrylic night guard is got a little bit of research saying that it's potentially better, but I don't do many of those because they're not comfortable. I have tried to wear one. They're just rough.
So even though it has good intentions, if you're not comfortable,
if it's not if it's too uncomfortable to wear and the patient's not going to wear it, well, then what's the point? So like I'll do kind of like a hard soft hybrid or a thermoplastic. It's a material that's very rigid and wears well, but it has a little bit of give to it. And so it's a compromise, but it's more comfortable. I find that patients will wear it.
Okay.
Now, is it textbook the best? No, but if you're not going to wear it, then it's nothing. What's the point? So,
how do you deal with patients that say, because you wear a night guard,
I
right?
do.
And you were saying that you hated it at first?
It took some getting used to. I will tell any patient who's going to wear a night guard, you have to stick with it. It takes some getting used to.
Yeah.
I mean, my problem is I'm a bad clencher, and I've got
too.
lots of recession from it. You will have to fix me. But I got lots of recession, and when I first made one, it wasn't that it was uncomfortable. It's just getting used to wearing something in your mouth when you sleep. And in the beginning, you're going to be like, I kind of hate this. But I made myself do it, and after 2 to 3 weeks, now I can't sleep without it.
You know, it's
I'm
funny.
So used to it now.
I was talking to somebody else about the same thing, like just about night guards, and they were telling me the exact same thing. Like they couldn't deal with it at first, and now they can't sleep without it.
Yeah, now it's like if I lay down and I don't have it in, I'm immediately like, bing, I gotta go put my night guard in, because you just got what you used to.
Yeah.
So it's a curve that takes some getting used to. Don't give up on it. So process-wise, so we can kind of go down some other stuff. Like I said, there's a couple different kinds. Most of the ones that us general guys are making tend to be that thermoplastic one, just because it's more comfortable and they're pretty durable. You can adjust, we'll do impressions on you, have the lab make it, and then we adjust the bite to get everything feeling nice and even. The goal is when you bite down, everything feels like it hits even. And when you slide around, there's no weird lumps or bumps. It's fairly comfortable. The idea being is I can't make you stop grinding at night. It's just what your brain's gonna do. But I want you wearing on that plastic, and I want things hitting evenly so that we're not overloading one side of your joint, which will make things hurt, click, pop, and we're engaging the muscles evenly to lessen wear and tear on those. Because I mean, a big complaint people will have is like, oh, I wake up and I feel this tight sensation here, or like burning right up in here. You've overworked those muscles all night. It's kind of like if you were lifting weights all day and you're like, oh, I'm sore and I'm burning. Same thing. So that's kind of the main purpose of your night guard. There are things you can buy from a store. You can go and get those boil and bite things like that. I'm not a huge fan of those just because the fit is not very good, and what it does is you can't adjust bite on those. Depending on your parafunctional habit at night. If you're a clencher, you may be able to get away with one of those because you're just squeezing and you want something in between the teeth. I still don't think they're good because they don't have enough thickness. When you boil and bite in those, you almost bite all the way through. And they don't have enough bulk of resistance to really even out any kind of forces. Not a big fan. If you are a grinder, a lot of times it will make your pain worse. Because the problem is, if you're a big grinder, you want freedom of movement. So you're not over torquing your joints up here. If you boil and bite into something, you're making notches for your lower teeth. You can't move out of those. And if you're squeezing and grinding and you've locked yourself in, you are going to wake up hurting. Because you are now really making those muscles and joints do way too much work. So,
and what could happen long term with damage to that? You know,
if you've got chronic inflammation in your TMJ joint, all the bad things that come with chronic inflammation, you can get scarring in your joint capsule. The TMJ joint is weird. It's a hinge and it slides and it's all inside this tissue capsule. You can get degeneration of the capsule. You can get the ligament in the back of how far it's allowed to stretch can get overstretched or scarred up to where you can't fully open and close all the way. You can get degeneration of the actual bony condyle. I mean,
I've seen people get that joint replaced.
And the joint replacement is awful. They've almost stopped doing those because the prognosis is horrible.
It's scary. If I ever needed that,
it's not. And so, anything that's got chronic long-term inflammation is kind of the equivalent. You can get basically arthritis in your joint.
And that's scary. Because I've apparently, I didn't even know I was clenching. I was making night guards in dental school, and I didn't even know I was clenching until I graduated from dental school and I was in residency. And stress is not even it, because they're like, oh, like, you know, it's like stress induced. Like, no, I've just been clenching my whole life. And now that I think about it, I think I've been clenching like probably like my teen years. And that's what I see with some of my patients, like in their teen years, they're clenching, right?
Yeah, I make a lot of night guards for high school students even.
Yeah.
I mean, they're just, and they wake up and they're like, I'm just sore.
Yeah, I mean, again, like you got recession, you got, you know, gum recession, right? So you're gonna have sensitivity, you're losing bone, like, you know, the support around your teeth, right? It's bone and gum. You're causing potential fractures of your teeth.
Yes.
So if you have fillings or large fillings that, you know, could have been crowned or whatever, then now those teeth are breaking. Depending how those teeth fracture, if they break below the gum line,
you can't
then you need a dental implant or bridges or whatever. Now, even if you bridge and you're a hardcore clencher, you're putting more forces on fewer teeth, right?
Yeah.
And then also, here's another thing: if you've had any sort of cavity or you've had a filling, the clenching like crazy or grinding can create these tiny little micro fractures in your teeth, which then can allow that bacteria to give a pathway to go down there and just explode, literally. You know, like just like all this damage that's occurring to your teeth that wouldn't have necessarily happened. So basically, and then also we were talking about your joints, right?
Yeah.
So all the damage that can happen, like that stuff really does scare me, especially because I'm a clencher, right? And I cheated, like I did, like, you know, Botox, but I gotta do it every 4 months.
Yeah, I mean,
it's expensive too.
It's a legit treatment. I mean, things of treatment options. I mean, Night Guard is your basic start.
Yeah.
And for a lot of people, that's enough.
Yeah.
But for those that are worse, if you've got a lot of muscle pain, Botox is kind of a new up and coming thing that's working really well for a lot of people.
But it's pricey.
It is. It's pricey, and it's not a. There is no permanent fix for that.
Yep.
You know, it's just something you got to keep doing.
Can you build up resistance to it over time too?
Honestly, don't know. I haven't done that. You'd have more experience.
Yeah,
than I do.
they do talk about that. That's a possibility. You know.
And then there's other stuff joint wise. I mean, all the way into if it's bad enough, what they call arthrocentesis, where they basically take a large gauge needle, insert it into the joint capsule, and flush it out to get all those inflammatory factors out.
Yeah.
And same deal, it's not a one and done fix. It's something you periodically have to go back and do, where you'll either flush it with saline or even sometimes steroids if it's bad enough.
Yeah.
And it's such a complicated joint that they years ago tried to do TMJ joint replacements, and I actually had a patient when I was in residency at a VA hospital that had both sides joint replaced, and it's awful. They fail constantly, and so they don't do them.
You never want to go down that path.
No, they don't do them I've never heard of them being done anymore because that joint, it's such an oddball one, and it takes so much weird off-angle forces that I think they use some kind of weird biocompatible Teflon to allow it to slide. It all breaks down, and then they get degenerative bone destruction. It was a nightmare.
You gotta find the specialists of the specialists of the specialists for this type of procedure.
TMD, like chronic TMJ pain patients, that's a hard road.
Yeah.
It really is.
You don't ever want to go down that road.
And if you unfortunately are one of those patients, finding relief is very difficult. It's just a really hard thing to treat. It really is. And, you know, I'm willing to bet that within the next few years it will become like a recognized specialty of just temporomandibular joint disorders because it's so multifactorial and it's so difficult to control because it's something that we do subconsciously. And trying to get people to not do it, it's like trying to tell yourself to not breathe. You know, you can't do it.
Yeah.
But from a general dentistry treatment standpoint, we typically get into night guards, and if you've got a flare up, there are some low grade muscle relaxers that we'll prescribe for about 10 days worth to kind of get you back on track. If you've got issues more so than that, then we tend to look into referring you out to someone who either specializes in TMD or there's a good number of oral surgeons that also have a pretty good knowledge in TMJ treatments that we get you hooked up with. It can be a challenging thing to find relief for. It really is.
There are some people that are definitely very experienced in it, and like that's what their practice revolves around. I remember at the Grapevine Dentist, like there was a doctor who was circulating some information that he was a specialist in that aspect.
Good.
But I mean,
need more of them.
As with anything in life, prevention is key. So, you know, get that night guard. You know, I did Botox personally, but I'm gonna get a night guard made. I've had my night guards made in the past. Quick question. What do you think about that? What is that, NTI?
NTIs,
the ones on the front?
the little short ones?
Yeah.
They are good for certain people. They're... You want to tend to kind of make a hybridized version, one that's a little bit bigger that covers, say, the front 6 teeth. Because what they have found in the original design of the NTI, it only went over your 2 front teeth and down. Yeah. They were finding that it was the same concept I was talking about where you try and put your front teeth together and squeeze and your brain won't let you. Well, that gets lessened at night. They were finding that people were actually like orthodontically moving their front teeth.
Oh, that's not good.
And they were finding...
it's giving people buck teeth.
Yeah. And the ones that, even if you do more coverage, people who wore them really long term, since nothing would touch in the back, they were actually finding either super eruption teeth if you wore them a lot.
And what does that
or, then you're in big then you've got to do braces and shove everything back up, which
at an older age is a big deal.
And nerd talk in pushing teeth back into bone takes forever.
Right.
Or they would find that they would actually start getting their joint would shift. It would fall. And
so let's not talk about that option anymore.
It'd do some weird. I only do those on a very select few patients that I've only had a couple that their gag reflex was so bad they could not actually tolerate a night guard.
Okay.
And so it's very rare. I've only done maybe like 3 of them.
One last question. What if they had Invisalign or braces and they need to keep their teeth and they are supposed to wear a retainer? Like, can you just wear this instead of a retainer?
Yeah, that actually works really good for those. If you've had braces, if you had Invisalign, we'll do an upper night guard and it will fit rigid and tight enough that it will function as your upper retainer.
Okay. Awesome.
And then you just wear your lower one as well, and you can still chew against that. One other kind of thing we also recommend, a night guard kind of as an outside thing, if you had a lot of cosmetic work done.
Okay.
If you did a lot of crowns or veneers or anterior fillings that involve the edge of your front teeth or lower, I always recommend to those patients, even if I don't know if you're a huge clencher or grinder, I recommend get a night guard to cover those over, because if I'm replacing you're working on your front teeth because you've chipped and worn them and you now want them to look pretty, well, nothing's as strong as tooth. If you're able to chip and break tooth, you're going to chip and break my crowns. Even if I put you in the most ideal bite I can, protect your investment. If you already spent a good amount of money to get the smile you wanted, couple extra, couple another $100 to make sure you don't break them is 100% worth it. I recommend to all my cosmetic cases, make you a night guard to protect these crowns.
Right. I mean, you got to really listen to your dentist on this part, because I don't do crowns, general dentistry, all that type of stuff. But I 100% believe, based off of what I see, I'm the guy placing implants, doing all these things.
You're seeing them when they've broken them so bad they're split in half.
Yeah. If I was financially motivated, I would tell you not to get a night guard, But I'm, if you really want to do the best, exactly, you want to do the best thing for you, get a night guard.
They're in the scheme of dentistry, they're pretty inexpensive compared to, breaking one tooth and doing cracking one tooth and doing a crown. You could have bought like 5 night guards.
Yeah.
I mean, they're relatively inexpensive for the benefits.
Or if you needed to crack the tooth in the wrong area.
Oh god, if you had to take it out in an implant, you could have bought like 15 or more night guards. I mean, come on.
Well, how much is a night guard?
Typically,
with insurance and non-insurance.
Most insurances don't cover night guards. Okay. Some do. Okay. Ballpark number is around $200 to $300 for night guards.
That's cheap.
They're not outrageous.
Yeah.
Some are a little more depending on your fee schedule. The most I've ever seen was $500, which was a little excessive. But even again, a crown is a lot more expensive than that.
Right.
And the fact that you broke a tooth.
Yeah.
So they're worth it.
And again, there's different types of night guards, so there's different costs. So I have patients asking me costs of different types of procedures. It really depends. Wisdom tooth is not a wisdom tooth.
There's not a one blanket fee for
exactly.
A really rough one versus a super easy.
Exactly, or dentures and stuff like that. But we'll talk more about that. Yeah. But hopefully you guys found this information very helpful. Again, please give us a thumbs up and a follow on our channels, North Texas Dental Surgery, for our Instagram and our YouTube.
And The Grapevine Dentist on YouTube and Instagram.
Yep, so clearly this guy knows a lot, so...
I try.
Go give him a follow, maybe even see him at his practice in Grapevine. Well, actually, we're both partners at that practice, so... Again, so hopefully you found this information helpful, and we'll see you later.
Thanks a lot.